Hello everyone, my name is Khaled Harmoush. I am a recent medical graduate from the University of Near Eastern Cyprus. I took the USMLE Step 2 CK nearly 2 months ago and I scored 255. In this video, I will talk about the most important resources that every student or doctor who is about to take the exam must do or must study. I'm gonna mention some exam taking strategies in addition to briefly explaining about my experience with the exam. So I hope you find this lecture helpful, and good luck to all of you. Okay. So what's the Step 2 CK exam? Step 2 CK exam is actually the second exam of the three exam series, as I said, taken by med students or doctors who want to do their residency programs in the USA after they graduate. And what does it cover? Step 2 CK stands for clinical knowledge. So as the name indicates, it covers the main subjects we studied during the last 3 years in medical school, like internal medicine, obstetrics and gynecology, psychiatry, biostatistics, general surgery, and etc. How long is the exam? The exam is long and tiring. It's a full 9-hour one session exam. It consists of 8 blocks. Each block contains 40 questions, and you have to complete each block in 1 hour. So this is a total of eight hours, and you have a 1 hour break that you can use it the way you prefer. So some people divide the breaks. I mean, they take a break after each block. Others take a break after a couple of blocks. So this is totally depending on you. So my advice to you is to use your breaks wisely. So what are the most important resources for the exam? As everyone know, I think USMLE World or UWorld question bank is the gold standard of this exam. It's actually the key to ace the exam. You have to do it at least twice. The first time you do UWorld is for learning and taking notes, and the second time is for timing yourself, learning more concepts, integrating subjects together, and reinforcing your memory and memorizing. So a special note here for you words is that it should be done in details or thoroughly. Why? Because every single word in your word counts actually. I mean, you have to know why you got the answer correctly. You have to read the whole explanation, understand and memorize the idea, and you have to look at the wrong options to know why you got them wrong. So sometimes the question on the real exam can be from the wrong option. So you have to be familiar with the whole situation, with the whole case, whether it's correct or wrong. A special note here for people who are willing to take the exam very soon, probably in 6 months or 1 year, is that you have to buy the online version. Please do not rely on the offline one, as the question bank is periodically updated and new questions are added on a daily basis. So I remember 3-4 days before going to the exam center, UWorld added around 20 to 25 questions, which contained very new concepts to me, things that I have never heard of. And luckily, I had at least 5 to 6 questions from the new things on the real exam. So please do not rely on the offline version if you want to ace the exam with a good score. Another resource is AMBIS Library. It's a great resource to study topics that are not very well covered in UWorld. For example, if you think that the management of disease X is not very well mentioned or covered in UWorld, you can easily go to AMBIS Library and fill the gaps and fill what you're missing, and basically you would be fine because you will be studying the disease as from A to Z. Whether you're talking about the pathophysiology, pathology, signs, symptoms, management, diagnosis, and treatment. So AMBIS Library does a great job here. UWorld by statistics review and UWorld notes. So here a special note again about UWorld by stats review is that biostatistics is heavily tested on the exam, whether it's step 1, step 2 CK, step 2 CS, or step 3. So you will find it during all your steps. If UWorld Biostats Review is an A+ resource to study the subject. I mean, it contains around 70 to 75 questions. It covers most concepts of the exam, and after doing it, you will really feel the difference. And if you are weak at the subject, you will turn your weakness into strength. UWorld notes. Some people prefer to do them. It's like 1,100 slide PDF folder contains all UWorld concepts. First aid for the USMLE Step 1 book. Please note that it's Step 1, not Step 2. These sections must be done or must be read before going to the exam, because you will have a fair amount of questions that are from Step 1 things. Immunology, pharmacology, microbiology, biostats, public health are a must to read before going to the exam. I mean, in my case, I got 10 to 20 questions, Step 1 stuff, and I was lucky because I did Step 1 before Step 2. Now, for people who didn't do Step 2 before who didn't do Step 1 and they want to do Step 2 before Step 1, my advice to you is to watch videos, probably Boris and Beyond videos on these three subjects, and make sure you really ace them, because 10 to 20 questions are good proportion in the exam, and they are generally easy points to catch. So do not waste your marks and do not hemorrhage your score by not doing them. Anki app, it's a flashcard app which I use and was really helpful. Research says that using flashcards regularly help reinforce your memory by repetition. So whenever you repeat, however you repeat the question or the concept, you can repeat it many times, and the more you repeat it, the more it can stick to your brain. So Anki app does a great job here. The best way actually is to make your own cards while studying UWorld, but this is very time consuming and I do not recommend it, especially for people who are taking the exam very soon. So you can use prepared flashcard decks that you can find them online or on the Anki app, or on the Anki website, sorry, UWA or Zanki Step 2. And UWA is by far the most important one, because it covers UWorld from A to Z in a way that makes you really relate things between subject or between systems. So I highly suggest doing UWA flashcards if you are thinking of doing Anki. Optional resources that you don't really have to do them, such as CMS forms, MBME, Master the Board Step 2 and Step 3 books, First Aid for the Step 2 CK book, Kaplan books. However, they are not recommended. I do not recommend Kaplan for anyone unless you have a fair amount of time, like 2 to 3 years. You want to prepare slowly, you want to read. Yeah, just going through Kaplan is not bad. Di Virgilio for surgery, it's a very or a highly recommended book for surgery. Like, I'm one of those people who had weaknesses in surgery. Like, I felt that I really need a resource that can help me fill my gaps or at least increase my score in surgery subjects. So I googled it and I found Di Virgilio as by far the most highly recommended book, and I did it once and I really found it very useful. So my suggestion is to do it, but it's optional. As I said, it's not a must as UWorld and but it's still a good resource. So now the good question, or the most commonly or the most frequently asked question, is how should I start? Well, if you already cleared Step 1, then I recommend jumping into Step 2 or UWorld Step 2 directly. You don't need to waste your time on any books or any other resources. But for people who are taking Step 2 CK before Step 1, you may need some books to warm up, like Master the Boards and Kaplan. However, this is actually totally depending on your foundation and clinical knowledge. So if you are good, if you did a great job during your clinical years, you may not need to read any book actually, and you can go to UWorld directly. My advice is to try at least 2 or 3 blocks from UWorld before reading any book. And if you find that if you find that there is a problem or you are missing something, then reading a book before going back to UWorld is still a good idea. Well, how should I study UWorld? UWorld is not only a question bank. It's not like a question and answer though. If you get the answer correctly, then you click next and go to the other questions. And I mean, it's not like that. If you do it like that, then I think you're not gonna do great on the board exam. So here are my suggestions. Your first round of UWorld should be done properly. Do not rush it. Take your time and understand every single word of it. I've just mentioned this a little bit earlier. So this is your key to crush the exam. Okay. I'm one of those people who used to finish only 40 to 50 questions a day during my first round, and I don't really regret it. I used to study around 8 hours a day, probably from 10 a.m. to 5 or to 7 or sometimes to 9. And I was only able to finish 50 or 60 questions at max. But this is the way you want to do during your first round, because UWorld is a learning tool and a study tool. You have to crush it, you have to ace it, you have to understand every single concept of it to be able to do well on the real exam. Take your own notes or make your own flashcards. Don't copy paste UWorld explanations, and do not do more than 2 blocks a day, because 80 questions are too much. This is my my opinion. Some people still do 2 blocks a day and they end up doing very great on the real deal. But my advice during the first round is not to do more than 2 blocks. Like 80 questions are okay, 70, 60 is great. Do not time yourself during the first round. My advice is do not use the timer or do not adjust the clock while doing questions during your first round. Remember that you are now learning the material. You are not timing yourself. You are not assessing yourself. The exam is still a few months ahead, so you still have enough time to study and time yourself later on during your second round. So take your time, do it on a random untimed mode. Do not be disappointed if your average of the correct answers is low. Remember, UWorld is a study tool, not assessment. I've just talked about this. Some people say, okay, I'm scoring pretty average on my first round of UWorld, like probably 50 to 60%. I would say this is totally normal. It's okay. You're learning now. You're learning the concepts and the subject. You are not assessing yourself. So take it easy. Take it with as they say, with a grain of salt, and enjoy your studying. Like, yes, you need to worry about the score from the second round on. But not the first one. Your second round of UWorld should be done in timed and random mode. Try to simulate yourself as much as you can by doing 4 to 5 blocks a day. Focus on tiny details and memorize as much as you can. Always challenge yourself by doing questions, and please know everything about or as much as you can about the disease. And yes, as I've just said, use AMBUS library to complete what you missed. Build your stamina. Now, the exam is actually not only knowledge, so it's stamina and knowledge and time management or exam taking strategy. So try to simulate the exam as much as possible by doing 6 to 8 blocks a day or 5 to 8, whatever you can. I mean, how many blocks you can during the second round. Eat healthy and do some sport. And remember to do it as you're training for a big sport event. I mean, sometimes you really get tired during the first 100 meters of running, then you will be fine, you will be better, and you will be able to run 150 and so on until you reach your target. So this is exactly the same story here. Like, build your stamina. Step 2 or the steps in general are a marathon. They are not a sprint. Okay. Time management is so important as well. Time is your main enemy on the exam. So try to improve your exam taking strategies. Think on the go. While reading the question stem, you have to think of the diagnosis, or at least the differential, or what the examiner wants you to think about. Do not spend too much time on one question. I mean, don't spend 2 to 3 minutes on one question. Mark it and review it later. Again, the golden rule for this exam is 60% knowledge, 40% stamina, time management, and exam techniques. So, like, a commonly asked question here is how to approach long questions. My approach was the following, but I mean, you can find your own, and you can stick to a plan that suits you the most. But this is my suggestion, and I advise you to try it out. Like, if it works out, then it's fine. If it doesn't, then you have to find your own one. But what I used to do is to read the last line of the question to know what they want. I mean, are they asking me about diagnoses, best next step, pathophysiomechanism, drug side effect, and so on? And then I would take a quick look at the answers or at the options to see whether it's the endocrinology, pharmacology, cardiology. And then now I would start reading the question and highlight the important facts like race, gender, age, vitals, and etc. And I will rule out wrong options on the go, as I said. Like, when you see sometimes a clear sentence on the question stem, then you can directly stop there and go to the options and rule out the wrong one because it's obviously wrong. Then now you, like, most probably you will be stuck between two answers. So go with your gut. Sometimes your inside talks and says, please pick this. If your inside insists on picking something, please go with your gut. Like, your gut is always telling, like, is 90% telling you the truth, unless there is a very clear thing in the question stem that tells you that this is wrong. So trust your gut and proceed, and don't spend too much time on the question. This is a key actually to ask the exam. A special note here about long questions they are most probably easy, and they just want to get on your nerves and waste your time. Do not be scared. Some questions have more than 10 options. They are usually straightforward and can be answered in 30 seconds. Now, it's pretty scary to see 10 options for one single question, and you will be scared, like, okay, what should I do with this? How am I supposed to answer this question in like seconds? And I have 10 to 15 options. Sometimes it reaches 15 options actually, no exaggeration. So such questions are so easy. Like, if you know the concept from the question stem, you can just pick the correct answer. You don't really need to rule out or do anything else. In my exams, I had a lot of these questions, and I ended up answering everyone in probably 30 to 40 seconds at max. So chill. Biostatistics and medical ethics. The reason I decided to discuss these two subjects briefly is because we didn't learn these two subjects in our medical school, or I think in most medical schools of the Middle East. So and they are heavily tested on the exam. USMLE people always ask about them. You will have around at least 20 to 25 questions from them. So you should be prepared, and you should use the correct resources in order to ace these two subjects. So if you want to score high on the exam, you must master them. As I said, board examiners love to ask about them, at least 25 questions. Biostats is not easy. Take it seriously. Ethics is confusing. Do as many questions as you can. So suggested resources for Biostats: Boards and Beyond videos for step 1, UWorld Biostatistics Review, BRS book, and YouTube. For ethics, I would use 100 Cases by Conrad Fisher, UWorld, BRS Behavioral Sciences, Dirty Medicine, 30 Cases of Ethics, and YouTube and Numbers. So you do as many resources as you can until you kill it. Otherwise, it's gonna be you're gonna struggle with it on the real day. Self-assessment. Now, after doing the first round of UWorld, revising your own notes, doing some flashcards, it's time to assess yourself, to see where you stand. So they tell you where you stand, they show your weaknesses, and they give you a 3-digit score that's close to your real score. For CK, only 2 exams are reliable: UWorld Self-Assessment 1 and 2. If you buy the question bank online, they will give you UWorld Self 1 and Self 2. However, if you don't want to buy the question bank, you can buy them separately. UWorld Self 1 is generally overpredictive. They overpredict your score by 10 to 15 marks. UWorld Self 2 is the most accurate one. The real exam is similar to it in terms of difficulty, length, and score. It must be taken a few days, or at least or 2 weeks before the real day. A special note here about MBMEs that they are useless during as self-assessment tools on step 2 CK. However, you can still use them to practice. Do not rely on their scores. They are generally underpredictive. I remember myself taking an MBME 10 days before my exam, and they gave me 233 or 235, and I was so disappointed. I started doubting myself. But then I decided to go with UWorld Self-Assessment 2, and I scored 20 points higher than my score on MBME. And on the real exam, I scored 5 points higher than my UWorld Self-Assessment 2. So UWorld Self-Assessment 2 is by far the most predictive. So mistakes to avoid. All of us make mistakes during prep, especially if you are studying for a long time. So here are some mistakes I made, and I want you to avoid them. Do not study UWorld shallowly. Like as I said in the previous slides, you have to do it in details. Do not start your dedicated period very early. I mean, do not say, okay, I'm gonna study 15 hours a day, and I'm gonna finish the exam earlier. No, you will be burnt out actually. So what you do is start gradually. Start like with 2-3 hours a day, like 20 questions UWorld a day. Then the day after you can increase them by 5 until you reach a target. You stick to that target, and then probably 2 months before the exam you can make it super dedicated, by which you can do 15 hours of studying a day. So this is my advice to you. Do not listen to negative people. Stay away from them. Don't listen. Some people say, okay, CK is hard. Steps are always, it's risky to take step 2. What if I fail it? What if I get a bad score? Just keep away from these people if you want to succeed, actually. Do not doubt yourself. You are brave enough to take the journey. You will doubt yourself a lot. You will have a lot of ups and downs. But my advice to you is always trust your knowledge, trust yourself, and always surround yourself with good people like your families, good friends who can encourage you and support you during the long journey. So my advice to you is do not listen to negative people and stay positive. Do not use unreliable resources. Please do not use books that are not highly recommended. Do not use resources that, like, some question banks are just commercial, like Lectorio. I'm sorry for mentioning this, but Lectorio is a waste of money and time. I used it. I tried it. I had a trial and I found it very, very useless. So basically, I would not waste my time on it. Do not worry too much. The exam doesn't define who you are. If you score a little bit lower than expected, do not doubt yourself. Do not say I'm a bad doctor or so on, because it's just an exam. All of us have good days and bad days. Probably it's a bad testing day, that you didn't do well, you didn't sleep well, you felt dizzy, you were sick. So just take it easy. Now I will briefly mention my experience. I studied for a total duration of 6 months. Phase 1, I used to do 50 questions a day, Anki flashcards. After I finished my first round of UWorld, I did my incorrect questions and took UWorld self-assessment 1 and scored 248. Phase 2, it was super dedicated. It was around 50 days actually, before my exam. I used to study 10 to 14 hours a day. I worked on my work areas, did a second round of UWorld, in addition, along with Anki, UWorld CK notes, and my own notes. And then at the end, I took UWorld self-assessment 2 and scored 252. This was actually 7 days before my real exam. The big day, what happened to me during the big day or before the big day, I couldn't sleep for more than 4 hours. I am actually an insomniac patient, or person, not patient. I don't sleep before big exams. I didn't sleep before my step 1, and I was worried not about this actually on my step 2 CK. However, I was able to sleep for 4 hours. I had a good breakfast. I started the exam at 8 in the morning. I took the first 2 blocks back to back, then a 10-minute break. Block 3, then 5 minutes break. Block 4, 7 minutes breaks. 17 minutes break for lunch. Block 5, 5-minute break. 6, 10-minute break. Block 7 and 8 back to back. The exam was medium hard to me. It was not very lengthy. 50% was very straightforward. 30% needed a second and a third order thinking. They needed you to think, to extract the important information from the question stem, make your own diagnosis, and then answer the question that is probably asking you about the next step, or the pathophysiology, or the side effect, or the long complications, and etc. 10% was extremely hard, and 10% was out of nowhere. Of course, you will have questions that you have never heard before. They call them WTF questions. My advice for these questions is not to spend too much time on them. Just trust your gut and go with the answer you feel is correct. So nothing to do more about them, because they know that most students don't know this concept though. Post-exam feelings. Feeling bad, lost, and numb is more than normal. You will not feel good, by the way. If you feel good, then there is a problem. So feeling bad here is good. I mean, you don't really feeling bad, lost, and numb is more than normal. Do not do like me and count your mistakes and go Google your questions and see how many mistakes you got, because you will not be able to calculate your score Nobody knows how USMLE people calculate our 3-digit score. Nobody on earth can do that except them. So please do not count your mistakes. Just enjoy. You are done. Have a long break. Go back to your social life. Go back to the gym. You are done. Enjoy it and trust your assessment scores. Please feel free to contact me if you have any questions on this email. Good luck to you, and remember, it's a marathon. You have to be patient, you have to build your stamina, and you have to improve your exam taking strategies. I hope you all the best and good luck with your journey. Thank you.